Hi everyone and welcome back to our channel ADC Aspirants. I'm Dr. Hanaa and today I am so very happy, excited and enthusiastic to be conducting this interview or podcast, whatever you may call it, with one of the very talented and extraordinary candidates that I've come across. The moment I saw her on the day of the OSCE's mocks, I knew there was something very special. And that is why I want everyone to know this person, Dr. Sanaa. Congratulations to you. Very well done. How are you feeling?
It feels great. I'm so blessed to be, out of that part of journey. The journey has just begun. So,
Oh, yes. There's one journey after another waiting for all overseas
Exactly.
dentists, even when they pass clear the ADC exams. But actually, I am also very interested to know your journey, Dr. Sanaa, and I want everyone, because I know out of this podcast, a lot of people will get not only motivated, but they are going to get tips and strategies as to what you did. We're going to be focusing, for the sake of this interview, only on OSCEs. But let's start about, talking a bit about you. Where are you from, about yourself, and what motivated you to pick up this ADC exams?
Yes. Well, thank you for having me and to have this opportunity to share my ADC journey. So my name is Sanaa Hanaa, and I was born in Australia, but I was raised all my life in Lebanon. And I graduated from Beirut, Lebanon, with a Bachelor of Oral and Dental Surgery in the year of 2022. But during those years, I always knew that my next step would be to go to Australia and start my journey there, because I felt so connected to Australia that part of my family is over there as well. So I used to visit them every now and then. So it was part of my passion to pursue Australia. But then when I moved as a freshly graduate, so it was in the late 2022 that I moved to Australia. So after I just graduated, it was a bit challenging because there was some hesitation about whether I should start this ADC journey being as a freshly graduate or not. But I'm someone who commits to her decisions. Once I know what I want, I pursue it and I don't give up. And I knew that this was part of my goals. So during those years, I was working as a dental assistant. And through that journey, I fell in love with dentistry all over again. And it ignited my passion again and again. And it really made me realize that that's my passion, that's my dream. And it gave me a whole new perspective about dentistry here in Australia. The professionalism, the patient-centered care that they deliver to their patients, at least with the dentist that I was working around. And God gave me the right people around me, and I'm so blessed and thankful for all those, dentists and mentors that were with me throughout this whole journey. So that's how it all began, step by step towards the ADC.
That's wonderful. Believe me, Dr. Sanaa, every word that you've spoken right now makes so much sense, because this is what I talk to candidates and overseas dentists. There are times we lose faith in ourselves. We feel like we're not worth it, or are we good enough? Do we have it in us to clear this very difficult or stressful exam? I say this is not difficult, this is stressful. If you can manage that aspect, you can definitely manage this exam. And we will be talking a bit.
Exactly, because this is a big part that I also want to talk about. So
yes, I will be definitely coming to that. You not only surrounded yourself with positive people, but you are a positive person yourself, which is how you got, that positivity around you.
And that's how I did it with you, because from day one, the energy and the positivity that was from you, that you gave to me as well, you can feel it. You can get affected by the people in front of you or around you. So you were one of the greatest mentors out there, Dr. Hina, and I'm forever grateful for that, really.
Thank you so much. That means a lot. And please tell everyone I'm not paying you money to say this.
This is my genuine feedback, people.
Oh, thank you so much. I'm just kidding. And so moving on from that positivity, so you've taken up this huge challenge, you cleared ADC written examination, you're ecstatic about it. Now comes the big topic about dealing with OSCEs and dealing with practicals. So we're going to leave out the technical aspect. Let's come straight to your OSCEs. How For everyone who's preparing for the OSCEs, how important the part one material or the part one preparation has been. How did you manage to strike a balance between reading that theory, which is relevant to the OSCEs? How did you balance both of that, like the balance between role plays and reliving your theory part as well? What did you do for that?
So, as a second attempt, so I passed my ADC Part 2 as a second attempt.
Sure.
And I started to understand after I failed my first attempt about how significant both are, like the theory and the OSCEs. And I started also going through the books that I used to study for Part 1. Even though I passed my Part 1 from my first attempt, it gives you a whole new perspective when it comes to OSCEs, because during OSCEs and during Part 2 exam, it's not just about, understanding the concepts, but also how to deliver them in these 10 minutes and that time that you have. So you don't have to just understand what you're wanting to deliver, but also how you have to talk to your patient, not just on a theoretical point of view, but also, being friendly and having that effective communication. So what I thought had more significant, apart from the technicals, was communication. So I knew I wanted to put more focus on communication. And I genuinely do feel that communication has much bigger effect on the ADC journey than the technicals, because in technicals, you are in control of it. But in communication, it's about this 10 minutes that you have to deliver on that time. So I did it on a daily basis. I divided my time 30%, let's say, theoretical, and then 70% communication, and then doing role plays with one friend. I just picked one friend, and it all goes back to the right people as well. And she was a very dear friend of mine who was with me throughout this whole journey, Dr. Amin. And we practiced role plays together for 2 months or even more. But that was after I started understanding the cases, So give yourself time to really study by yourself and understanding each cases with the courses that the mentor gives you, and then start writing it in your own words. And then do role plays. And even I still remember 1 month before my exam, it was just role plays between myself and I, because you also want to hear yourself talking and see yourself. So I was actually taking videos of myself, and then I was hearing it for the first time without any videos. And then for the second time, I was only seeing that video with no voice. And then for the third time, I was hearing it and seeing it. So I was also looking at my body language, which is very important. And I was listening to my voice. Being confident with your voice is also very important. So yes, I felt everything was intertwined and connected in a way.
Absolutely. I think that's so true, that if you're able to explain the points to yourself, either on the, in front of the mirror or while listening to your own recordings, it makes a huge difference. Because if you're fumbling, if you're going out of, that pace, how is your patient supposed to understand if you yourself are not able to understand that? So I think that's a very, very good piece of advice. And one study partner, but a steady study partner is so important.
Yes.
I had one as well, and I'm greatly thankful to all the people who I've practiced with and who practiced with me. So great piece of advice there. Now I'll come back, and rewind a bit where you said that this was your second attempt.
Yeah.
And I would really want you to talk, about what changes you made from your first to your second attempt, because people lose hope, they break when they see a fail. What did you go through and how did you overcome that?
Thank you. So, I still remember after my first attempt, I was seeing my results, and I looked at the screen and sat quietly for a few minutes. And then I told myself, okay, I'm going to do it again. And this time it's going to be different. Because that experience gave me a new different perspective not only about how I view ADC and the structure, but also how I view myself. And before then, I realized, because I do a lot of reflection, and it's very important to reflect on not just your failures, but everything that you go through in life. So before that, I was focusing a lot on the how and the what. For example, how am I going to pass and what am I going to do? But after my first attempt, I started to focus more on the why. Why am I doing that? Why am I becoming a dentist in Australia? So that why became so much stronger that I started to realize my purpose even more and more. I want to help people. I want to make people smile. I want to be a dentist because I want to help my family. This whole ADC journey is not just for yourself. It's a teamwork. It's with your family and with your people that are around you. My family in Lebanon and in Australia have supported me so much that I feel it's also time to pay it forward in a way. So it felt much bigger dream than just my dream. And from that point onwards, I became completely committed to my preparation. So I really focused on the value of self-talk. I'll talk about the structures, but self-talk really matters during that ADC journey that nobody
What kind of
talks about it.
self-talk? Yes, nobody talks about it.
Nobody talks about it.
I'm so surprised and so honored and happy that you are bringing it to everyone's notice. What kind of self-talk did you do? What did you do, Dr. Sanaa?
Okay, I actually wrote on a piece of paper my goal, my dream through this ADC journey and what do I want to achieve. And then I signed it. I committed to that.
Wow.
And then I put it on the wall. And I'm like, that was me, like I was reading it on a daily basis. Apart from also, praying and practicing gratitude on a daily basis, which was the first thing before anything else. This gives you power, this gives you hope, and it gives you strength as well. And I also practiced the self-talk about the fact that I am a dentist in Australia. The I am, not I will or I hope. You are already, so you have to believe in yourself, because if you are not going to believe in yourself, like nobody will, because no matter how many people around you are believing in yourself, if you don't have the power, you cannot achieve it.
Absolutely.
So yes, coming to that communication part, I structured my OSCEs on a different perspective, and I had a plan in front of me for 2 months or even 3 months where I stopped working and I was fully committed, and I blocked the outside noise, but I still committed to my mindset and my physical health and my mental well-being, because yes, ADC journey subconsciously wants you just to focus on ADC, but you really need to also take care of yourself. Because it really hit me at the end that if I am not being able to manage my stress as a doctor or as a dentist, how am I able to give advice to my patient managing your stress? So it really went back to the life mocks that I also want to talk about.
Yeah. Yes, absolutely. That we were going to, but I'm getting so engrossed in your beautiful talks, honestly, Dr. Sanaa, because candidates often talk about a lot of things like I applied this tip and I, spoke to that person, I listened to this podcast.
Yeah.
You've done a lot of self-work,
Yeah.
which is so important, and hats off to you for achieving that along with everything else.
Thank you. Thank you.
So,
Thank you.
you know how different it is when you're presenting cases to someone online
Yes.
and somebody who is now in front of you acting as an examiner, and you're supposed to be presenting your cases. And I remember, I want to talk about this for a second, maybe extra to all the candidates who are listening. Dr. Sanaa arrived at our center for a face-to-face OSCEs, and there was no greeting, no welcome, Dr. Sanaa, how are you doing? She was just ushered into the room and we started off because we wanted to give her the real stressful environment.
Oh my God, it was like the same exam experience, literally. Like you have two examiners as well in front of you.
Yes.
And
so please tell everyone about, how the live OSCEs, face-to-face OSCEs were for you, Dr. Sanaa.
Yes, yes. So really, I cannot emphasize enough how important face-to-face live mocks and live, OSCE practices were for me, because you like genuinely speaking, they were one of my highlights to my success.
Thank you so much.
Because it really, online practices are useful because that's how it's done. You have to have them online, and often when you do these online courses or role plays, you feel comfortable, you feel confident, you feel prepared. But face-to-face practice introduces a completely different element. You experience the real pressure. You become aware of your body language and the people around you, which are the examiners, and you learn how to present yourself and how you need to respond immediately under stress, which what you need to experience before the exam, because you don't want to experience that on the day.
Yes.
On the day, what really matters is how you manage the stress. So these live mocks were really helping me on managing my stress and delivering what I need to deliver as a dentist, and in terms of these communication cases as well. So the reality is that during the actual examination, knowledge alone is not enough. So these live mocks helped me so much because I was able to really feel the ADC examination center when I was with you and Dr. Vishal, because during that time Dr. Hina and Dr. Vishal were there. So it was actually two examiners that were conducting me, which is very similar to the ADC exam. And we had 1 minute break. So after each case, the bell rings, and then I go back to the hall and I wait for 1 minute, and then I come back again, and you have 10 minutes, 3 minutes to read the case, to read the scenario, and then 10 minutes to act. So I really felt that I was doing the exam on that day, and it really changed the whole perspective, because while I was talking about the online courses that it makes you feel comfortable and confident. So during my first live mock, it really hit me in a way that I didn't do good. So it really made me realize that, okay, I'm actually under stress, and I have stress that I'm not really understanding, or I wasn't even thinking that I had stress. I thought I had it all, good, and I'm prepared. And then that's when it all started to make sense. I started understanding that, okay, I need to manage my stress. So yes, I did more of the self-talk. I kept focusing on my health, and I did stress management strategies. And then when I did more live mocks, it made me realize that, okay, I can manage it and I can deliver confidently. So it's not just about doing one live mock, it's about really going out there and performing and doing it face to face. Because this is really a life-changing experience.
Absolutely.
Yes.
Thank you so much, Dr. Sanaa, for that. Because honestly, I believe that the more anxious and nervous you are before the exam, it's all right. But you have to be the most calm version of yourself on the day of the exam. So just become a monk on that day.
Yes.
So now let's talk about the day of the exam.
Yes.
How did you, it is stressful, I understand, but what did you, tell yourself? How was your experience in every station?
Yes.
Did you perform, did you feel like you underperformed in one, but you didn't let it affect your other stations? I mean, let's just go through that briefly.
That's a great question, and I'm happy to answer that and talk more about it. So before the examination, I really felt the burnout. So I really understood, okay, my body needs some rest. So 2 days before the exam, I genuinely rested and took my time to actually go through what I want to deliver on that day. And I constantly reminded myself before the examination that I had done everything in my control. And whatever the outcome is, I'm at peace with it. So I really had that self-talk that I had worked hard and I had prepared thoroughly, and I trust myself. So whatever the outcome would be, I'm going to be happy with it. So on that day, I remember I had communication on my first day before each room. So you have 6 rooms and 6 stations. Before each room, you have 1 minute before the bell rings. I still remember I was also doing a breathing technique. 2 inhales and 1 deep exhalation before I enter each room.
Wonderful.
And just reminding myself that I'm gonna smile and be friendly and be present because of what I went through from my failure. I realized that it's not about delivering the script or the details of the knowledge that you have, but it's also about active listening and being present with your patient, not the examiner. So I just reminded myself before each room that I'm present, I'm going to smile, and I'm gonna do good.
Absolutely.
So each room went. It's normal for the first room to feel a bit anxious and not deliver as much as you can. But it's okay because you can forget about it and move on to the next one. So don't get affected about what you delivered. It's more about what you can deliver in the next room and in the next one as well. And yes, I still remember I had 1 room or 2 rooms that I wasn't fully confident about, but I didn't let that affect me. And what really helped me is that we have a 30-minute break. So so during that time, during that lunch break, I sat with myself as well, not just, judging myself about what I did in the past rooms and in the past examiners, but I also worked on how should I improve? How can I get back stronger and more confident? So I didn't allow this to affect me. Rather, I worked harder, in my mind, talking to myself that I'm going to do it better. And I delivered much better than the first half. And
Wow.
I think that really made a difference because I really also observed myself after this lunch break that I was really delivering much better than the first half.
You felt the confidence.
I felt it. I felt it. And yes, the examiners are really helpful, and you just need to understand that no one is against you. No one in this ADC examination center or examiners are against you. It's you against you. So just be flexible and be calm.
Absolutely. That's very true. I think OSCEs is all about your personality coming out. Yeah. And you have to bring out your true personality. I teach candidates how to be polite. Some people are not good at that.
Yeah.
You have to be polite. You have to be gentle, kind, all of that. Even if it takes a lot of effort, we have to do certain things, which are not our forte maybe. But your personality has been and will be, I'm sure, amazing. Your patients are going to be very lucky, Dr. Sanaa, to be treated by you because your passion is dentistry. It's not just for the sake of giving exams that you've given it. You wanted to make a difference in people's lives, which is what you're doing. Now, this interview will make a difference in many, many candidates' life. You don't know it, but I can assure you for that. What is your last piece, words of wisdom for anyone who's maybe starting the journey or halfway through it and is kind of losing hope and faith in themselves? What would you say to them?
Yes. So for candidates who are just beginning their journey, stick to ADC aspirants because Dr. Hina is one of the best mentors out there because, I want to emphasize more about you, Dr. Hina, because what we went through together was very genuine and not just, mentor to a student, but you were really so open to helping me and you were so responsive during your WhatsApp as well, even though I know you have a heavy schedule in terms of part 1 exam and part 2 and your clinic and everything that you're doing. But the fact that you were supporting me on a daily basis really made a difference. And you were one of those mentors that really changed my view on ADC and communication as well, because you have a very beautiful way of explaining things very directly and very in a simple way. And I feel that's what every candidate wants. We just want to understand things in a very simple way, I mean, and at the same time, know what not to deliver, not just what to deliver as well. And thank you for all your efforts and your help.
Thank you for choosing us, to be honest.
Thank you. Thank you. So for candidates who are just beginning, just believe in yourself and in your mentors, because it's not the concepts are all the same. It's about how you also want to deliver it, but understand the concepts thoroughly, learn the communication, how to be more patient-centered approach, rather than just, being scripted. Seek guidance from just trusted mentors and just follow your gut and trust yourself. Yes, take opinions from different people or candidates who have gone through the same experience, but also believe in what you want as well. So understand as well why you want this path, because it's a long path and it's a tough one. So just understand why you want this in the first place. And for people who have done it before, I really want to encourage them to really reflect on themselves and not just on where they failed in the exam, and just don't focus on what went wrong, but also understand that because of your failures, you are able to succeed. So seek constructive feedback from the right mentors and identify your weaknesses and work on that. And finally, remember that ADC examination is not designed to identify perfect dentists. It's designed to really assess whether you communicate effectively and safely and make the right decisions and make the right clinical decisions as well, and just deliver in a very confident way on that day. So believe in yourself, and trust the process, and have faith.
Absolutely. What
Yes.
beautiful lines, Dr. Sanaa. Honestly, this
Thank you.
this should make a huge difference in anyone's preparation who's struggling a lot right now, or is finding it difficult to find the right time to prepare themselves enough for this exam. So thank you again. This brings us to the end to our
Thank you.
conversation. And thank you for your time, for your patience, and your beautiful words of wisdom. Again,
Thank you, Dr.
so much.
Heath.
And our congratulatory meeting is still due. We're going to be
Yes.
meeting each other soon, hopefully.
Yes.
So looking forward to that. Thanks
Looking
everyone for
forward.
watching as well. Thanks, Dr. Sanaa. Have a good rest of your
Thank you.